Thank you so much. I can't tell you what an honor it is to be here to receive the first inaugural award. And as we all know, that it really takes leadership, and really Bob Black's leadership of the department for the last 30 years has really been tremendous. And Bill and I have gotten to know him over the last 10 years and have amazing respect for what goes on here at Hopkins. One of the things that I believe is that you should always learn from your elders. And my father-in-law, Bill Gates Sr., who is about to turn 86 this fall, is one of the people that I learned from. Two important things that I've learned from Bill Gates Sr., which is, one is that if you receive a beautiful award like this, you should not put it up here on the podium. Because my husband and I were sitting in the front row, and Bill Gates received an award on behalf of the foundation. He put it here on the podium. It was a brand new award, and it crashed to the floor and shattered everywhere. So I learned from him that we should leave the award here. And the second thing I learned from him is he has been in this building far more than I have, and he's been saying to me for a very long time, you've got to go see Hopkins. And I follow Hopkins research quite vigorously, and I see the work in the field all the time, and it's really quite remarkable work, as you saw in the video. When Bill and I started in this field of global health, we really started together. In fact, we got to know each other in the software industry. I was working at Microsoft. I worked there for 9 years, really enjoyed it. And when Bill and I got married, he kept saying, I'm going to do the foundation one day, but it's going to be when I'm in my 60s. And slowly but surely, as we learned about family planning from some of the great researchers here at Hopkins, and as we learned about the difference that vaccinations could make in the developing world, and how small investments could really change a family's life and change economic development in the developing world, we got going on our foundation much more quickly. So if Bill were here today, he would be thrilled to be up here as well, my Bill with me. He couldn't be here today because this weekend he's on his way to Nigeria and Chad on behalf of polio. So we travel often and extensively these days on behalf of global health. As you heard earlier, the groundbreaking work that was done here by Carl Taylor, that village healthcare worker, we know that is what's making a difference now in countries like Ethiopia, Malawi, India. When you're starting to see those health statistics get better, vaccinations rates go up, women being able to access health services, it's because of that initial seminal idea that he proved out. Oral rehydration, one of the first things I saw when we got into global health work out in Bangladesh, was pioneered here at Hopkins. And millions, literally tens of millions of children's lives have been saved because of ORS. The Hib vaccine, we've known for a long time that diarrheal and pneumonial diseases are what kill these young children. And we needed those breakthroughs on the Hib vaccine. Those were pioneered here with Hopkins and many other partners, and really the policy changes that were needed to get that vaccine out in the world. And now we're seeing it being adopted wide scale around the world in the developing world. And it's, again, literally going to save millions of children's lives. So it's that cutting-edge research that we see time and time again that can only come from an institution like this. Now, I feel a little bad about some of the great researchers we've actually taken from Hopkins, like Gary Darmstadt, except that you have a faculty now that's 140 strong. And so it's amazing to see the graduates that are coming from a place like this. As Bill and I travel around and speak on behalf of these global health issues, one of the things that we try to get people to realize is that we have to be both impatient. We've got to get these innovative tools, these vaccines, these reproductive health, modern contraception out to families. So we've got to be impatient about the work, but we've also got to be optimistic. I think so often in the past, we talked about when we would see what was happening in the Horn of Africa and other places, we talk about the devastation of poverty and the suffering and the human misery that was connected with it. And believe me, when I go to the developing world, I see it and I feel it, and it's painful. But at the same time, there is huge optimism because of the innovation that's happening. Getting tools out in the developing world is literally changing people's lives. One of the statistics that Bill and I love, it's our favorite one, is back around the time I was born, back in 1960, 20 million children used to die under the age of 5. 20 million children every single year. Now, as of 2010, that number is well under 8 million children dying a year. That is a huge drop in the death rate of children. Now, 8 million is still way too many. In fact, the number is somewhere between 7.3 and 7.6 million, depending on whose statistics you believe in. But that's still too many. And the thing that I think we really came to realize as a global health field in the last many years was that we had to take that number apart and look at it and say, well, it's not enough to save the children who are 30 days to 5 years old with vaccines and other things we were delivering. We really needed to look at that first 30 days of life and say, what is it that's killing 4 million children still of that 8 million? And we finally are tackling that piece of the problem. So to tell you a little bit about what I see, I was in one of the most poor places in India about 18 months ago to see a cutting-edge research site run by Vishwajit, a researcher here from Hopkins, out in the most rural northern part of India. He's got his research totally embedded in the community, and what he's proving out is that cutting-edge social behavior change makes a difference. And by that I mean that if you teach a woman not about tools or expensive things, but about breastfeeding her baby, immediate and exclusive breastfeeding, keeping her baby warm, not washing the baby right away with a gritty, sandy paste or setting it aside, but keeping that baby warm and wrapped up, just with her own sari, makes an enormous difference. He's proving this out in this village, and in fact, during the time this research site has been up and running, if you ask the villagers what they've seen, and you say, if you ask all the women in the village, we got them all to sit around in a huge group like this, and you said, how many of you have lost to children? An enormous number of hands went up. Almost all the hands in the village went up. And when I said to them, how many of you lost a baby in the last 18 months? So many of the hands went down. And in fact, what Vishwajit's been able to prove in this remote village is that he can get a decline in the depth rate in those brand new neonates by over 54% just by teaching women behavior change. That's what I call cutting-edge research. And that's the kind of research that Hopkins pioneers over and over and over again. And so it's the partnership. It's the partnership of what Hopkins does with philanthropies, with other NGOs, with governments, both rural and governments that come out of the developing world, to take this cutting-edge research and then disseminate it and make it standard practice in the developing world. That, to me, is the legacy of this department of the last 50 years. That's what you've done, and I can't imagine, looking forward, how more excited I could be to see what comes next. So thanks for honoring us with this award.